what I call the anterior vertebral body line, which is just the anterior aspect of the vertebral bodies, and I want to see how those line up, and similarly, posteriorly, the posterior vertebral body line, looking at how those line up. You can have very severe fracture dislocation type injuries where there is malalignment of one level relative to the other, but in the cases of many patients that are older and they have degenerative disease, you can also see malalignment there that's not acute and it's not necessarily in the setting of their trauma. I then like to look at the posterior elements and the spinous processes particularly, which are back here. I look at each one individually. I think the sagittal gives you a good view of those, and looking for subtle fractures. These aren't the worst fractures in the world to miss in isolation, but if I can avoid it, I want to avoid it and catch it if I can. So I look at each one of these individually, and I also like to draw a line kind of just in my head, looking at the bases of the spinous processes throughout the lumbar canal too, just to make sure those line up. And again, if those do not line up, then you worry about some sort of dislocation type event. I then pay special attention to the facet joints at each level. And when I say facet joint, I'm talking about the inferior articulating facet of one level in addition to the superior articulating facet of another level. They meet together. Looking at the facet joints, I'm particularly concerned about widening of the facet joints relative to another level, so they want to be pretty consistent throughout the lumbar canal. Beyond widening, if there's perching of one facet, meaning one's kind of jumped up or higher, and it looks like they're just not quite aligned, that can suggest significant injury. And similarly, frank dislocation, where they just don't line up at all, that's alarming and something that you want to catch if you can. So I like to go basically at each level and look at these facets on both sides because they're bilateral structures and make sure they are pretty consistent in how they look in terms of their spacing, their alignment, and in this case, this is a nice example of normal. Finally, in the sagittal view, this is going to be your best view for looking at the vertebral body heights. You want to just make sure that they all look kind of nice and box-like and that they look similar at each level. You can sometimes see wedging of the superior end plates and what we call kind of a compression deformity. These are very common in the older osteoporotic patients, but you can also have burst and chance fractures that can cause a wedge-like appearance. So the sagittal is a good view to look at the morphology of the vertebral body and make sure they are normal, like I said before. I then move over to the coronal view. I think the coronal